Ni hao everyone. Pneumonia is the infection of one or both lungs. It usually manifests as cough with phlegm, confusion, nausea, diarrhea, chest pain, fever. The extrapulmonary symptoms are due to systemic involvement. Pneumonia is classified according to the pathogen, the way infection is acquired, the histopathology involved, viral, bacterial, and fungal, community acquired, hospital acquired, ventilator acquired, lobar and bronchopulmonary pneumonia. Curve 65 is a severity score done in community acquired pneumonia to decide which course of action to take where. C stands for confusion, U is for BUN value, R means respiratory rate, B represents BP at more than 65 years of age. Each yes means 1 point. 0 to 1 means OPD treatment. 2 to 3 means admission and management in general medical ward. 4 or more warrants an ICU. Complications of pneumonia are lung abscess, meningitis, septicemia, pleural effusion. Treatment is dependent on the cause. Take care and kindly do share, like and subscribe to my channel.